Well, Anderson, this would be comical if it weren't so serious and deadly. We have a president of the United States who says with a straight face, after being in office over 3 years, that he takes responsibility for nothing. Imagine that. We've never heard that ever out of the mouth of the president of the United States. The fact of the matter is that when the Obama administration left office, we left the national strategic stockpile fully stocked, adequately prepared, as one would expect it to be. That has been validated by independent journalists who had the opportunity to visit the stockpile in late 2016. But more than the stockpile, we left this incoming administration with all the tools that we had created for ourselves and that they needed to confront such a pandemic, because we understood that a pandemic was not only predicted, but was actually inevitable. And the only question was when. In 2014, President Obama warned the nation that this could happen. I established an office at the National Security Council in the White House purely for the purpose of tracking pandemics and outbreaks and biological threats. That office was disbanded in 2018 by the Trump administration. We ran a side-by-side exercise with the incoming Trump administration cabinet and the outgoing Obama administration cabinet 1 week before the end of the transition in early 2017. And that exercise was 3 hours long, and we went through three critical scenarios: a terrorism scenario, a cyber attack scenario, and a pandemic scenario, to alert them to this very real possibility and the priority we placed on it. And yes, as you mentioned, we handed them a 69-page playbook, which I've called Pandemics for Dummies. It tells you exactly what questions to ask, what steps to take when an outbreak emerges. And so this administration did not prioritize pandemic preparedness. They were completely behind the curve when the word came to them in early January of this year that there was an outbreak in China. In the first week of January, this was known to the CDC. And it was then briefed to the Secretary of Health and Human Services and the White House. That is the moment at which we ought to have been scrambling to get the testing kits that we needed created and deployed fully across the country. That's the moment where we should have said, okay, we know we're going to need more beds, more ventilators, more masks, more personal protective equipment than we have in our existing stockpiles. And then we have in our hospitals and healthcare facilities. Let's get out and source that material using the authority that the president has under the Defense Production Act. Had we started the testing and the procurement and the organization for the surge that we knew was coming in January, we would be in a very different place today, Anderson, in April, with fewer deaths, fewer economic consequences. And a less dire scenario than we have. But instead, the administration wasted more than 2 months. The president downplayed the threat. He misled the public. He compared it to the flu. And it wasn't until really mid-March that this administration started to take it seriously and compare it to the war that it is.